ನಮಸ್ಕಾರ. ಇದು ಆರೋಗ್ಯ ಕಾಳಜಿಯ ಕಾರ್ಯಕ್ರಮ. ಸಾಮಾನ್ಯವಾಗಿ ಒಂದು ಮಾತಿದೆ, ಪ್ರಿವೆನ್ಷನ್ ಈಸ್ ಬೆಟರ್ ದ್ಯಾನ್ ಕ್ಯೂರ್ ಅಂತ. ಅಂದರೆ ಚಿಕಿತ್ಸೆಗಿಂತ ನಾವು ಮುನ್ನೆಚ್ಚರಿಕೆ ವಹಿಸುವುದೇ ಲೇಸು ಅಥವಾ ಉತ್ತಮ ಅಂತ. ಎಸ್, ಕರ್ನಾಟಕ ಕ್ಯಾನ್ಸರ್ ಅವೇರ್ನೆಸ್ ಫೋರಂ ಮಂಗಳೂರು ಮತ್ತು ಮಂಗಳೂರು ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಆಂಕಾಲಜಿ ಸಂಸ್ಥೆಯು ಜಂಟಿಯಾಗಿ ಮಂಗಳೂರಿನ ಬೆಸೆಂಟ್ ಮಹಿಳಾ ಕಾಲೇಜಿನಲ್ಲಿ ಇತ್ತೀಚೆಗೆ ಕ್ಯಾನ್ಸರ್ ಅವೇರ್ನೆಸ್ ಅಂದರೆ ಕ್ಯಾನ್ಸರ್ ಜಾಗೃತಿ ಕಾರ್ಯಕ್ರಮವನ್ನು ಆಯೋಜಿಸಿತ್ತು. ಒಟ್ಟು ಈ ಕಾರ್ಯಕ್ರಮದ ಉದ್ದೇಶ ಮತ್ತು ಆಶಯ, ಬೆಸೆಂಟ್ ಮಹಿಳಾ ಕಾಲೇಜಿನ ಉಪನ್ಯಾಸಕಿಯಾಗಿದ್ದಂಥ ಪ್ರೊಫೆಸರ್ ಸರಿತಾ ಧರ್ಮರಾಜ್ ಅಮ್ಮುಂಜೆ ಅವರು ಕ್ಯಾನ್ಸರ್ ಕಾರಣದಿಂದಾಗಿ 1-2 ವರ್ಷಗಳ ಹಿಂದೆ ನಮ್ಮನ್ನು ಅಗಲಿ ಹೋಗ್ತಾರೆ. ಸೊ ಇಂಥ ಸಂದರ್ಭದಲ್ಲಿ ಧರ್ಮರಾಜ್ ಅಮ್ಮುಂಜೆ ಅವರ ನೇತೃತ್ವದಲ್ಲಿ ಕರ್ನಾಟಕ ಕ್ಯಾನ್ಸರ್ ಅವೇರ್ನೆಸ್ ಫೋರಂ ಅನ್ನುವಂಥ ವೇದಿಕೆ ರೂಪುಗೊಳ್ಳುತ್ತೆ. ಈ ವೇದಿಕೆಯ ಮುಖ್ಯ ಆಶಯವೇ ಎಷ್ಟು ಅಂದರೆ, ಯುವಜನರಲ್ಲಿ ವಿದ್ಯಾರ್ಥಿಗಳಲ್ಲಿ ಆರೋಗ್ಯದ ಬಗ್ಗೆ ಕಾಳಜಿ ಮತ್ತು ಜಾಗೃತಿಯನ್ನು ಮೂಡಿಸುವುದು, ಅದರಲ್ಲೂ ಕೂಡ ಬಹುಮುಖ್ಯವಾಗಿ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಜಾಗೃತಿಯನ್ನು ಮೂಡಿಸುವುದು. ಸೊ ಈ ನಿಟ್ಟಿನಲ್ಲಿ ಒಂದು ದೊಡ್ಡ ಮಟ್ಟದ ಅಭಿಯಾನ ನಡೆಯಬೇಕು. ಅದು ವಿದ್ಯಾರ್ಥಿಗಳ ನಡುವೆ, ಅದು ಕಾಲೇಜಿನಲ್ಲಿ ಈ ಒಂದು ಅಭಿಯಾನ ನಡೆಯಬೇಕು. ಸೊ ಮೊದಲ ಇಂಥ ಒಂದು ಕಾರ್ಯಕ್ರಮ ಮಂಗಳೂರಿನ ಬೆಸೆಂಟ್ ಕಾಲೇಜಿನಿಂದಲೇ ಆರಂಭವಾಯಿತು. ಮಂಗಳೂರು ವಿಶ್ವವಿದ್ಯಾನಿಲಯದ ಕುಲಪತಿ ಪ್ರೊಫೆಸರ್ PS ಎಡಪಡಿತಾಯ್ ಅವರು ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಚಾಲನೆ ನೀಡಿದರು. ಮಂಗಳೂರು ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಆಂಕಾಲಜಿಯ ಸಂಸ್ಥೆಯ ವೈದ್ಯರುಗಳು, ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸಹಕಾರವನ್ನು ಕೂಡ ಕೊಟ್ಟಿತ್ತು. ಇಡೀ ಒಂದು ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ, ಜಾಗೃತಿ ಮೂಡಿಸುವ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಡಾಕ್ಟರ್ MS ಬಾಳಿಗ ಅವರು, ಡಾಕ್ಟರ್ ಶಾಂತರಾಮ್ ಬಾಳಿಗ ಅವರು, ಡಾಕ್ಟರ್ ಪ್ರತೀಕ್ಷಾ J ರೈ ಅವರು ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಮತ್ತು ಅದರಲ್ಲೂ ಕೂಡ ಮುಖ್ಯವಾಗಿ ನಮ್ಮ ಜೀವನ ಶೈಲಿ ಜೊತೆಗೆ ಆಹಾರ ಮತ್ತು ಕ್ಯಾನ್ಸರ್ ಎಲ್ಲ ವಿಚಾರವಾಗಿ ಜಾಗೃತಿ ಮತ್ತು ಒಂದಷ್ಟು ಮಾಹಿತಿಯನ್ನು ವಿದ್ಯಾರ್ಥಿಗಳ ಜೊತೆಗೆ ಹಂಚಿಕೊಂಡಿದ್ದಾರೆ. ಇದು ಕಾರ್ಯಕ್ರಮ ವಿದ್ಯಾರ್ಥಿಗಳ ನಡುವೆ ನಡೆದದ್ದೇ ಆಗಿದ್ದರೂ ಕೂಡ ಈ ಮಾಹಿತಿ ಅದು ಸಮಸ್ತ ಸಮಾಜಕ್ಕೆ, ಸಮಸ್ತ ಜನತೆಗೆ ರೀಚ್ ಆಗಬೇಕಾದಂಥ ತುಂಬ ಜರೂರತ್ತಿನ ಮಾಹಿತಿ ಇರುವಂಥ ಕಾರ್ಯಕ್ರಮ. ಈ ಪೂರ್ತಿ ಕಾರ್ಯಕ್ರಮವನ್ನು ನೀವು ನೋಡ್ತಾ ಹೋಗಿ. ಕುಲಪತಿಯವರು ಭರವಸೆ ಮತ್ತು ಆಶಯವನ್ನು ವ್ಯಕ್ತಪಡಿಸಿದ್ದಾರೆ. ಮಂಗಳೂರು ವಿಶ್ವವಿದ್ಯಾನಿಲಯ ವ್ಯಾಪ್ತಿಯ ಎಲ್ಲ ಕಾಲೇಜು ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಕಾಲೇಜಿನ NSS ಮತ್ತು ಯೂತ್ ರೆಡ್ ಕ್ರಾಸ್ ಸಂಸ್ಥೆಯನ್ನು ಬಳಸಿಕೊಂಡು ನಾವು ಆರೋಗ್ಯ ಜಾಗೃತಿ, ಅದರಲ್ಲೂ ಕೂಡ ಕ್ಯಾನ್ಸರ್ ಜಾಗೃತಿಯ ಮುಂದಿನ ಕಾರ್ಯಕ್ರಮಗಳನ್ನು ನಾವು ನಡೆಸ್ತೇವೆ ಅನ್ನುವಂಥ ಒಂದು ಆಶಯವನ್ನು ಮತ್ತು ಅವರು ಒಂದು ಭರವಸೆಯನ್ನು ಕೂಡ ಕೊಟ್ಟಿದ್ದಾರೆ. ಜೊತೆಗೆ 3 ಮಂದಿ ವೈದ್ಯರು ಕೂಡ ಮಾತನಾಡಿದವರು, ನಾವು ನಮ್ಮ ಆಹಾರ ಶೈಲಿಯನ್ನು, ನಾವು ನಮ್ಮ ಜೀವನ ಶೈಲಿಯನ್ನು ನಾವು ಜಾಗರೂಕತೆಯಲ್ಲಿ ನಾವು ಸಾಗಿಸ್ತಾ ಕೊಂಡೋದ್ರೆ ಖಂಡಿತವಾಗಿಯೂ ಮುಂದೆ ಬರಬಹುದಾದ ಆರೋಗ್ಯ ಸಮಸ್ಯೆಯನ್ನು ಸಾಕಷ್ಟು ಮೊದಲೇ ನಾವು ಗುರುತಿಸಿಕೊಳ್ಳಲಿಕ್ಕೆ ಸಾಧ್ಯ ಅಂತ. ಸೊ ಇದು ಈ ಇಡೀ ಒಂದು ಕಾರ್ಯಕ್ರಮದ ಆಶಯ. ಮತ್ತು ನಾವು ಯಾವ ರೀತಿಯ ತಪಾಸಣೆಗಳನ್ನು, ರೋಗ ಬಂದ ಬಳಿಕ ತಪಾಸಣೆ ಅಲ್ಲ, ರೋಗದ ಗುಣಲಕ್ಷಣ ಬಂದಾಗ ತಪಾಸಣೆ, ಮತ್ತು ಅದಕ್ಕಿಂತಲೂ ಪೂರ್ವಭಾವಿಯಾಗಿ ನಾವು ಯಾಕೆ ತಪಾಸಣೆ ಮಾಡಿಕೊಳ್ಳಬೇಕು ಅನ್ನುವಂಥ ವಿಚಾರಗಳನ್ನು ಈ 3 ಮಂದಿ ವೈದ್ಯರು ಕೂಡ ನಮ್ಮ ಮುಂದೆ ಇಟ್ಟಿದ್ದಾರೆ. ಪೂರ್ತಿ ಕಾರ್ಯಕ್ರಮವನ್ನು ನೋಡ್ತಾ ಹೋಗಿ. ಒಳ್ಳೆಯ ಮಾಹಿತಿ ಮತ್ತು ಒಳ್ಳೆಯ ಜಾಗೃತಿ.
ವಂದೇ ಶಾರದಾ ಗುಣದಾ ಭುಜನವಾಸಿನಿ.
I request our principal, Dr. Satish Kumar Shetty, to welcome the dignitaries and the gathering.
Honorable Vice Chancellor, Professor PS Edapadithaya, the President of the Women's National Education Society, the Vice President of Women's National Education Society, the members of the management, the resource persons who come all the way from NITE and Mangalore Institute of Oncology and KMC, whom I'm going to introduce a short while from now, my dear students and faculty members and members of the media and press, and also the invitees. The cancer awareness program is well thought of in today's time, and I wish to congratulate the organizers, Karnataka Cancer Awareness Forum, Mangalore, Mangalore Institute of Oncology, and the Student Council of Besant Women's College for taking up and
As rightly said by Buddha, if you light a lamp for someone, it will also brighten your path. May this light brighten all our path.
Checkups. We have adopted 5 villages. We have got teaching and non-teaching staff. We have got 2,500 students on the campus. We have got 207 affiliated colleges spread over 3 districts, Kodagu, Udupi and Dakshina Kannada. We have got around 1 lakh students in the entire network of Mangalore University. And out of 1 lakh students, 67% of girl students. So it means we have got a serious concern for all these preventable diseases. And at this point of time, we must understand and appreciate the difference between human being and being human. So being human is more important than just remaining as human being. We can try to become better human being only through becoming universally compassionate. And ultimately, the spirituality of our existence is be good, do good, and at the end of the day, do good anyway, without expecting anything. Karmanyavadhikaraste mapalesh kadachana. We got 3 wonderful doctors here. Vaidyo Narayana Hari. Kanni Kano Devaro. So they have got a kind of moral responsibility to spread the awareness about this kind of dreadful disease. It will not be dreadful provided you detect it in the early stage itself. By becoming well aware of the symptoms, because normally we say never treat the symptom but the disease. That is what the medical punchline. We have to understand the root cause of that, and we have to be alert and attentive to what's happening to us. My brother-in-law is also a doctor. He tells me, if you know what is happening to your body and the mind and little soul, no medicine is required. You can handle it by yourself. But the question is, it is easier said than done. Why? Because our mindset, there should be a mind shift. Let us not take it very lightly. Arogyave bhagya anta. Nannudi matra alla. Today we realize the significance of this. If health is lost, everything is lost. ಒಂದು ಡಯಾಬಿಟೀಸ್ ಅಂತ ಡಿಟೆಕ್ಟ್ ಆದ ಕೂಡಲೇ ನಮ್ಮದು ಮೀಟರ್ ಡೌನ್ ಆಗುತ್ತೆ. ಆನಂತರ ನಿಮಗೆ ಹೈಪರ್ ಟೆನ್ಷನ್ ಕೂಡ ಇದೆ ಅಂತ ಹೇಳಿದ್ರೆ ಅಯ್ಯೋ ಹೀಗೂ ಉಂಟೆ ಅಂತ ಆಗುತ್ತೆ. ಆನಂತರ ಏನೂ ಮಾಡಲಿಕ್ಕಿಲ್ಲ, ಬಿಕಾಸ್ ಯು ಕ್ಯಾನಾಟ್ ಸಿ ದ ಲೈಟ್ ಎಟ್ ದ ಎಂಡ್ ಆಫ್ ದ ಟನೆಲ್. ಯು ಲೂಸ್ ಯುವರ್ ಹಾರ್ಟ್, ನೀಡ್ ನಾಟ್. ನನಗೆ ಯಾವಾಗಲೂ ಪದ್ಮವಿಭೂಷಣ್ ಡಾಕ್ಟರ್ BM ಹೆಗಡೆ ಅವ್ರು ಹೇಳ್ತಾರೆ, hypochondria is more dangerous ಅಂತ. Hypochondria is nothing but unnecessarily worrying about your health. ಇದು ಒಂದು ಎಕ್ಸ್ಟ್ರೀಮ್ ಆದರೆ, ಇನ್ನೊಂದು ಡೋಂಟ್ ಕೇರ್ ಆಟಿಟ್ಯೂಡ್. ನನಗೇನಾಗೋದಿಲ್ಲ, ಕಾಂಪ್ಲೆಸೆಂಟ್ ಆಟಿಟ್ಯೂಡ್ ಆರ್ arrogance attitude. But health care system will not permit this kind of complacent or arrogant attitude. We have to be responsible to ourselves, responsible to our family, responsible to the institution, responsible to the society at large. ಯಾಕೆಂತೇಳಿದ್ರೆ ನಾವು ಹೇಳುವಾಗ ಇಂಡಿವಿಜುವಲ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ಅಂತ ಹೇಳ್ತೇವೆ, ಅಟ್ ಮೈ ಇಂಡಿವಿಜುವಲ್ ಲೆವೆಲ್, ಅಟ್ ಮೈ ಓನ್ ಲೆವೆಲ್. ನೆಕ್ಸ್ಟ್ ಲೆವೆಲ್ ಬರೋದು ಇನ್ಸ್ಟಿಟ್ಯೂಷನಲ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ. ಹೌದು, ಇನ್ಸ್ಟಿಟ್ಯೂಷನಲ್ ಸೋಷಿಯಲ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ಇದೆ, ಕಂಪನಿಗಳಿಗೆ ಕಾರ್ಪೊರೇಟ್ ಸೋಷಿಯಲ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ಇದೆ. ಹಾಗೆ ಎಲ್ಲರೂ ಸೇರಿಕೊಂಡು ಇಂಥ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿಯನ್ನು ನಾವು ಆನರ್ ಮಾಡಬೇಕಾಗತ್ತೆ. ಆದ ಕಾರಣ ಪೀರಿಯಾಡಿಕ್ ಸೆಲ್ಫ್ ಹೆಲ್ತ್ ಚೆಕಪ್ ಮಾಡ್ಕೊಳ್ಬೇಕಾಗತ್ತೆ. ಸೆಲ್ಫ್ ಚೆಕಪ್ ಮಾಡಲಿಕ್ಕೆ ಏನು ಸ್ಕಿಲ್ ಬೇಕು, ವಾರ್ನಿಂಗ್ ಸಿಗ್ನಲ್ ಅನ್ನು ಸೆನ್ಸ್ ಮಾಡೋದು ಹೇಗೆ, ಸರ್ವ್ ಮಾಡೋದು ಹೇಗೆ, ಸ್ಯಾಟಿಸ್ಫೈ ಮಾಡೋದು ಹೇಗೆ ತಿಳ್ಕೊಳ್ಬೇಕಾದ್ರೆ ತರಬೇತಿ ನೀಡಬೇಕಾಗತ್ತೆ. ಅದಕ್ಕೆ ಇಲ್ಲಿ ರಿಸೋರ್ಸ್ ಪರ್ಸನ್ಸ್ ಇದ್ದಾರೆ who are highly committed to the medical profession, and also they are committed to spread this kind of social awareness. ಆದ ಕಾರಣ ಅರ್ಲಿ ವಾರ್ನಿಂಗ್ಸ್ಗೆ ನಮ್ಮ ಮೇಯನ್ನೆಲ್ಲ ಕಣ್ಣಾಗಿ ಮಾಡಿ ತಿಳ್ಕೊಳ್ಳುವಂಥದ್ದು ಭಾಳ ಮುಖ್ಯ. ಡು ನಾಟ್ ಪ್ಯಾನಿಕ್, ಅಟ್ ದ ಸೇಮ್ ಟೈಮ್ ಡು ನಾಟ್ ರಿಗ್ರೆಟ್ ಲೇಟರ್ ಆನ್. ಸೊ ಇನ್ಹಿಬಿಷನ್ಸ್ ಮತ್ತು ಮೆಂಟಲ್ ಬ್ಲಾಕ್ಸ್ ನಮ್ಮಲ್ಲಿ ಇದೆ ಅಂತ ನಾವು ತಿಳ್ಕೊಂಡಿದ್ದೇವೆ. ನಾನೊಬ್ಬ ಕೌನ್ಸಿಲರ್ ಆಗಿ ಸೈಕಲಾಜಿಕಲ್ ಲೆವೆಲಲ್ಲಿ ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳೋದಾದರೆ, ವರ್ಕ್ ಲಾಜಿಕ್ ಈಸ್ ಡಿಫ್ರೆಂಟ್ ಫ್ರಮ್ ವರ್ಕರ್ ಲಾಜಿಕ್, ಸ್ಟಡಿ ಲಾಜಿಕ್ ಈಸ್ ಡಿಫ್ರೆಂಟ್ ಫ್ರಮ್ ಸ್ಟೂಡೆಂಟ್ ಲಾಜಿಕ್. ಹಾಗೆ ಹೆಲ್ತ್ ಲಾಜಿಕ್ ಈಸ್ ಡಿಫ್ರೆಂಟ್ ಫ್ರಮ್ ದ ಪೇಷಂಟ್ಸ್ ಲಾಜಿಕ್. ಇಲ್ಲಿ ಲಾಜಿಕ್ಕಿನ ಮಿಸ್ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಇದೆ. ಆದ ಕಾರಣ ಇಡೀ ಎಂಟೈರ್ ಪ್ರೋಸೆಸ್ಸಲ್ಲಿ ಮೈಂಡ್ ಸೆಟ್ ಇಸ್ ದ ಚಾಲೆಂಜ್. ವಿ ಮಸ್ಟ್ ಬಿ ಏಬಲ್ ಟು ಕ್ರಿಯೇಟ್ ಮೆಂಟಲ್ ರೆವಲ್ಯೂಷನ್ ಇನ್ ಎವ್ರಿ ಒನ್. ಆಗ ಆಗತ್ತೆ. ಸೊ ಇಲ್ಲಿ ಇರುವಂಥದ್ದು ಎರಡು ನಾನು ಕಂಡುಕೊಂಡಾಗೆ, ಒಂದು ಸೆಲ್ಫ್ ರಿಯಲೈಸೇಷನ್ ಅಂತ. ಮನೆಯವ್ರು ಹೇಳಿದರೆ ಗೊತ್ತಾಗಲ್ಲ. ಮನೆಯಲ್ಲಿ ಶ್ರೀಮತಿ ನನಗೆ ಹೇಳಿದರೆ, ನೀವು ಚೆಕಪ್ ಮಾಡಿ, ಗ್ಲುಕೋಸ್ ಲೆವೆಲ್ ಚೆಕಪ್ ಮಾಡಿ, ಯುವರ್ ಡಯಾಬಿಟಿಕ್ ತಿಳಿದ ಕೂಡಲೇ ನಾನು ಮಾಡ್ತಾ ಇದ್ದೇನೆ ಅಂತ. ಮಾಡ್ತೇನೆ ನಾನು, ನನಗೆ ಗೊತ್ತುಂಟು ಯಾವಾಗ ಮಾಡಬೇಕು ಅಂತ. ಸೊ ಇಲ್ಲಿ ಏನಾಗುತ್ತೆ, ವಿ ಟೇಕ್ ಸರ್ಟನ್ ಥಿಂಗ್ಸ್ ವೆರಿ ಲೈಟ್ಲಿ. Therefore, there is every likelihood of missing the early warning signals. Again, because of mindset or taking things very lightly, if you miss it, you are missing the bus forever. ಆದ ಕಾರಣ ಒಂದು ಗಾಡ್ ಗಿವನ್ ಅಪಾರ್ಚುನಿಟಿ ಉಂಟು. ಏನು? ಅರ್ಲಿ ಸಿಗ್ನಲ್ಸ್ ಅನ್ನು ವಾಚ್ ಮಾಡಿ, ಸೊ ದ್ಯಾಟ್ ಪ್ರಿವೆನ್ಷನ್ ಈಸ್ ಆಲ್ವೇಸ್ ಬೆಟರ್ ದೆನ್ ಕ್ಯೂರ್. ಇನ್ವೇರಿಯಬಲಿ ಬಂತು ಅಂತಾದರೆ ಡು ನಾಟ್ ಪ್ಯಾನಿಕ್. ಅದನ್ನು ಫೇಸ್ ಮಾಡಬೇಕು ಅಂತ ನನ್ನ ಬ್ರದರ್ ಎಲ್ಲ ಹೇಳ್ತಾರೆ. ಫೇಸ್ ಮಾಡಬೇಕಾಗತ್ತೆ. ಏನಾಗತ್ತೆ? ಈಸ್ ದಿ ರೈಟ್ ಸ್ಟೆಪ್ ತಗೊಳ್ತಾ ಇದ್ದಾರೆ. ಆದ ಕಾರಣ ಇದರ ಜೊತೆಗೆ ಮಂಗಳೂರು ವಿಶ್ವವಿದ್ಯಾಲಯ ಸದಾ ಕೈ ಜೋಡಿಸ್ತದೆ. ನಮ್ಮ 207 ಕಾಲೇಜುಗಳಲ್ಲಿ ಕೂಡ ಇಂಥ ಕಾರ್ಯಕ್ರಮ ನಾವು ಆಯೋಜಿಸಕ್ಕೆ ರೆಡಿ ಇದ್ದೇವೆ. ಅದರಲ್ಲಿ ಕ್ಲಸ್ಟರ್ ಕಾನ್ಸೆಪ್ಟಲ್ಲಿ ಮಡಿಕೇರಿ, ಪುತ್ತೂರು, ಉಡುಪಿ, ಮಂಗಳೂರಲ್ಲಿ ನಾವು ಇಂಥದ್ದು ಮಂಗಳೂರು ವಿಶ್ವವಿದ್ಯಾಲಯದ ಮುತುವರ್ಜಿ ವಹಿಸಿ ನಮಗೆ NSS ಇದ್ದಾರೆ, ಯೂತ್ ರೆಡ್ ಕ್ರಾಸ್ ಇದೆ, ಇವ್ರ ಜೊತೆ ಎಲ್ಲ ಮತ್ತೆ ಸಮಾನ ಮನಸ್ಕರ ಜೊತೆ ಸೇರಿ ಮಂಗಳೂರು ವಿಶ್ವವಿದ್ಯಾಲಯ ಮುಂದಿನ 1 ವರ್ಷದಲ್ಲಿ ಡಿಸೆಂಬರ್ ಟು ಡಿಸೆಂಬರ್, ನಾನು ಯಾವಾಗಲೂ ಹೇಳ್ತೇನೆ, ಆ ಒಂದು ಪವರ್ಫುಲ್ ಪೀರಿಯಡಲ್ಲಿ ನಾವು ಇಂಥ ಕಾರ್ಯಕ್ರಮವನ್ನು ಹಮ್ಮಿಕೊಳ್ತೇವೆ. ಇಂಥ ಇದಕ್ಕೆ ಮಂಗಳೂರು ವಿಶ್ವವಿದ್ಯಾಲಯ ಸದಾ ಕೈ ಜೋಡಿಸದೆ, ನಮ್ಮ ಸಹಕಾರ ನಿಮ್ಮ ಜೊತೆಗೆ ಇದೆ ಅಂತ ಹೇಳಿ ಮತ್ತೊಮ್ಮೆ ನಾನು ಇಲ್ಲಿ ನೆರೆದಿರೋ ಎಲ್ಲರ ಪರವಾಗಿ ಶ್ರೀ ಧರ್ಮರಾಜ ಅಮ್ಮುಂಜೆ ಮತ್ತು ಅವರ ಕುಟುಂಬದವರನ್ನು ಅಭಿನಂದಿಸ್ತೇನೆ. ಮತ್ತು ಇಂಥವರ ಜೊತೆಗೆ ಇಂಥ ಒಂದು ಪವರ್ಫುಲ್ ಸೋಷಲ್ ಕಾಸ್ ಜೊತೆಗೆ ನಾವು ಕೈ ಜೋಡಿಸೋಣ. ಎಲ್ಲರಿಗೂ ಒಳ್ಳೆಯದಾಗಲಿ ಅಂತ ಹೇಳಿ ಮತ್ತೊಮ್ಮೆ ವೈದ್ಯೋ ನಾರಾಯಣ ಹರಿ ಅಂತೇಳಿ ನನ್ನ ಮಾತುಗಳನ್ನು ಮುಗಿಸ್ತೇನೆ. ಜೈ ಹಿಂದ್, ಜೈ ಕರ್ನಾಟಕ.
Will now be speaking on screening of cervical and breast cancer. Over to you, ma'am.
Myself, as you know, Dr. Pratiksha Rai, Assistant Professor in Department of General Medicine, K.S. Hegde Medical Academy, Derlakatte. You can be a victim of a cancer or survivor of a cancer. It's a mindset. Dave Pelzer once said. So it is very important to create a cancer awareness. It will have a great impact in prevention of the disease. I like to thank Dharmaraj Sir, Karnataka Cancer Awareness Forum, Mangalore Institute of Oncology, Besant Women's College, Mangalore, all the organizers for creating such a good program to have awareness on the cancer in the youngsters. It's a honor to share a stage with my fellow speakers, Dr. Shantram Baliga sir and B.S. Baliga sir. So what is cancer? Usually our organs of the body is made up of cells. The uncontrolled growth of these cells will form a tumor, which is known as a cancer. It is one of the most leading cause of death worldwide. So in the women, breast cancer and cervical cancer are the most common causes of cancers. So first I'll be talking about how to screen the cervical cancer. Before that, you should know what cervix is. It is a lowermost part of the uterus which is lead into vagina. If the tumor is present in the cervix, it is known as a cervical cancer. So why is it important to screen this cervical cancer? If you screen regularly, if you detect in the early stage, cervical cancer is 100% curable or preventable. So how do we screen? So before screening, we should know what are the risk factors of cervical cancer. One thing, the main common cause is a viral infection, that is HPV, human papilloma virus. So this is a most common cause. So if you detect this infection early, you can be very careful. The other causes will be early sexual intercourse. If the sexual intercourse is before 15 years, that is one of the risk factors. So, or having an early first pregnancy, it is also a risk factor for developing a cervical cancer. It is not that it is 100% there will be a cervical cancer, but it is the most risk factors. So low socio-economic status, or having a multiple sexual partners, or increased smoking, all these are the causes for the risk factors, but HPV is the most common. More than 90% cause is due to the HPV infection. So how can we prevent it? So we can prevent it by a regular screening. So it is important to us to screen it regularly so that we can detect it early. So how to screen the cervical cancer? We should, the doctor will do, you have to consult a doctor, she or he will do a pap smear. So who should start? From which age you need to start? Once you are 21 years or within the 3 years of your first sexual intercourse, whichever is the earlier, you need to start screening for the cervical cancer. So how do you screen? It is by the pap smear. So whether it is painful? No, definitely not. It is not painful, maybe slight discomfort. What the doctor will do, using a speculum, she will remove the cells of the cervix and examine. That is known as a pap smear. So how often you will do? If it is once you are 21 years or after the 3 years of sexual intercourse, you will go to a doctor, the pap smear will be done. If it is normal, you need to repeat it once in every 3 years. Okay? If there is a slight changes in the cells, if it is mild, then pap smear will be repeated within 6 months. If still changes are present, then the biopsy will be taken and sent for examination. If there is a severe change, dyskaryotic changes, then immediately the biopsy will be taken. So if the pap smear is normal, you need to repeat once in every 3 years. Okay, this is one of the most common screening tests you do. So once the HPV infection is present, it will take nearly 10 to 15 years to develop into a cancerous stage. Not all HPV infection will develop into a pre-cancerous stage or cancerous stage. Only up to 5 to 10% will develop a cancer. So that is why it is important you to screen. So what were the symptoms once you develop a cervical cancer? You can detect it early and treat it completely. So what are the symptoms the patient will present with? The patient will have a irregular bleeding. The patient may have a irregular bleeding, or during a sexual intercourse the patient may have a bleeding, or offensive vaginal discharge, a lot of white discharge with the offensive smell may be there. The patient may lose weight, the patient may have a lower abdominal or pelvic pain, the patient will complain of increased fatigue due to the lower hemoglobin. In the advanced stage, the patient, it will affect the bladder, rectum, all these things. The patient will have a frequent urinary infection or blood in the urine, or the patient will have a recurrent diarrhea, or there will be blood in the stools. These are the symptoms of cervical cancer. So if you have any of these symptoms, you need to immediately consult a gynecologist and do the needful. The gynecologist will examine you, do a colposcopy, biopsy, and confirm whether the patient is suffering from this illness. So depending upon that, there is a treatment. So why is it important to detect early? In cervical cancer, there are 4 stages. 1, 2, 3 and 4. In the stage 1, it will be confined to only cervix, whereas in the stage 2, it will go beyond the cervix. In stage 3, it will involve the lower vagina and pelvic floor as well. And in stage 4, it will spread into the other organs as well. So why is it important? If you detect the stage 1 cancer, cervical cancer, the 5-year survival rate is nearly up to 90 to 100%. It can be completely cured. Whereas as the stage increases, the survival rate will come down. For example, stage 2, the survival rate is only between 50 to 70%, whereas in stage 4 it is only 20%. So this is the importance of early screening and diagnosis. Not to panic. If you are diagnosed with the stage 1 as well, you can have a 80 to 100% of a 5-year survival rate. One more important thing is that before the patient becomes or the woman becomes sexually active, there is a vaccine available, that is HPV vaccine. You need to take that. If you are less than 15 years of age, 2 doses will be given, and if you are more than 15 years of age, 3 doses will be given. It will prevent from the cervical cancer. More than 90% of the cervical cancer can be prevented by HPV vaccination. So it is very important to take your vaccination. It is not that if you take a vaccination there is 100% prevention, but more than 90% prevention will be there, because there are other strains as well which these vaccines are not effective. So this is about the cervical cancer. So remember, before you becoming a sexually active, take the vaccination. Once you are sexually active, after 3 years, you start getting screened with the pap smear every 3 years, even if the pap smear is normal. And if you have any warning signs, as I mentioned, immediately consult a gynecologist. Not to panic. There is a 100% cure if it is a stage 1 cervical cancer. So one more cancer, most common in the woman, is the breast cancer. Same in this, if there is no lymph node involvement, there is more than 85% complete cure of the breast cancer. So how do we screen for the breast cancer? One thing is a self-breast examination. We can do in our home the self-breast examination. Every monthly we need to do a self-breast examination. How to do? You need to do every monthly. Stand in front of the mirror. Okay? Stand in front of the mirror. Lift your hand above. Okay? In a well-lit room. Observe your breast. If any lump is seen, or if any changes in the breast skin is seen, or if any changes in the nipple is seen. Okay? Lift your hand above and see. And then you keep your hand in the hips, okay, and then again observe for any changes.
Good morning, everyone. Indeed, it's a very privilege to come and give a talk in Besant College for 2 reasons. One, this institution has been catering to the requirements of the women population, and second thing is something to do more with personal this one. When this institution was planned by Sri Manil Srinivas Nayak, I happened to be my grandfather, who was very close family friend of theirs, and his name was also Srinivas Baliga. So he had come here, and I had come here with my grandfather and my parents as a small child during the initial days when the foundations were put. So it goes back to the time when I was a small child in my mother's arm. So we have seen this institution right from that point of time, because we are basically from Mangalore. And today I'm going to give a talk, and yesterday when I was telling my dad, my father, that I'm going to Besant, he told me that you had come with us when this inauguration, that what we call it as the Bhumi Pujanam, was done at that point of time. And there's a long history of association with Mr. late Manil Srinivas Nayak and our family. So it's a thing. Now I'm going to give a talk on diet and cancer. Now, when I say about diet and cancer, dietary aspect in cancer is one of the 4 important components, what we say. And I'm going to speak on a very small aspect, because we have time limitations we'll be speaking only for 15 minutes. That's what I understand. Now, before going into it, I have to say one thing, and that's my always a privilege, that today whatever I am, it's because of my teachers, Professor Abdul Rahman, who was the Vice Chancellor, then Sumati Madam, Dr. Sumati Bide, then Professor Uma Devi, then Dr. Maru and Dr. Alan Diamond, and also my alma mater. Next slide, please. That is Tata Memorial, where I did KMC Manipal, where I did my PhD, then Tata Memorial, where I did my part of my studies, and University of Illinois at Chicago. So today, whatever I am, it's because of these teachers and the institution. Because today, the training brought me to this. Yeah. Next slide, please. I won't go too much into the details because the Honorable Vice Chancellor has already spoken about what is the importance of cancer and how deadly a disease cancer is. But if I have to say it in a very short, this one, today globally cancer is the second most common ailment after cardiac, which leads to death. So if you look at that, that itself is a huge number. Next slide, please. Next. Now, when you look into, I'll come directly into the local aspect. It doesn't make sense in speaking about what the cancer is in US, what the cancer is in UK, what the cancer is in Delhi or in Bombay, because we have to speak about our issues and we have to address our issues. When I say our issues, I mean the local issues. And local issues is Mangalore Institute of Oncology has been taking extra initiative in understanding the cancers in Mangalore region. We are more bothered about our citizens, we are more bothered about our population, because it is our population which is respecting us a lot and is nurturing us as an academic, in both academic and in the societal things. So from that perspective, I'm going to speak upon cancer in Mangalore region. When I say Mangalore, let's keep it a little broad. Mangalore, Chikmagalur, North Canara, and even North Kerala, what we call it as the Kasaragod region. So I'm going to speak upon cancer in these regions because this is important for us. Now, if you look into predominantly, most of the cancers being detected in this area is the cancer of head and neck. And the principal reason for this is irrational use of alcohol, tobacco, smoking, and even snuff.
Good morning to all of you students. I didn't hear? Okay, I'm sure you are awake to listen to me. Right, let me ask a couple of questions. Who is the biggest killer in this world? Anybody? I'm not asking about any man. Just now you heard diet and cancer. So which aspect of diet is the biggest killer? It's the sugars. It's not fat, it's not the proteins, it's the sugar who is the biggest killer. Why the diseases have increased today is because the sugars have changed. Anybody has heard the name xenobiotic? Xenobiotic are chemicals. No food is safe food today. They use fertilizers, they use insecticides. All these substances get incorporated into the food. The rice what you have has the chemicals. Even though it is said to be organic, the water you drink has chemical substance. So that is because the environment is polluted. So that is called as xenobiotic. Now coming back to the cancer, you look at the cancer, one cancer could be hereditary. That's a genetically decided, for which we do not have much control, except that one has to look for that. Second, as Dr. M.S. Baliga said, it's a habits where you have absolutely control, you have absolute control. So prevention of cancer, where it is related to habits, the habits have to be modified. Third, you have viral infections, of which two are most important. One is liver cancer due to what is called as hepatitis B infection. a jaundice which happens due to hepatitis B virus. There are several types of viruses, of which 3 are important. Hepatitis A, it is benign, it doesn't cause much problem. Hepatitis B and hepatitis C. Hepatitis C is seen mostly in those who undergo dialysis. Hepatitis B we get through injections, or it could be sexually transmitted. So that's why use of disposables are promoted more. Or it could be by blood transfusion. So blood transfusion, they take precautions. Or human papilloma virus, that has been already mentioned. So these are the viruses which could cause cancer. Many a times, people without any habits, without any genetic predisposition, still they get into cancer. This is because one is diet has been said, lifestyle he has said, and then the other is environmental factors, of which what I'm talking about, xenobiotic, which also includes carcinogens, what we take inside. So many a times those who do not have any habits, did not have any infection, still they get, because these are the factors. So we love to eat food, no problem. What happens when you eat food? The body produces certain substances called as toxin substances, what we call as free radicals. Free radicals, these are toxins produced, and nature has given the similar mechanism to remove these free radicals, remove these toxins from the body. This is called as free radical scavenging system. Where do we get these substances to remove this toxin substance? As earlier mentioned, fruits and vegetables. Fruits and vegetables are the ones which provide a lot of vitamins and provide lot of antioxidants. So your diet should consist of 20 to 40% of fruits and vegetables. That has to be reversed. You eat lots of vegetables and a little bit of rice. So this is how you modify your diet. So less sugar, more vegetables. I'm giving the explanation what is the mechanism by which these toxic substances are removed. Your diet also contains, I'm sure is there anybody who has not had an orange drink? Anybody who didn't drink orange, raise your hand. 17 chemicals are added to make one orange flavor. 10 chemicals are added to make a pineapple flavor. So by drinking that, you are drinking more and more chemicals in your bodies. It may create problem, it may not create. It all depends on how much do you consume. Anything in moderation is okay, but anything in excess is bad. So you need to look at in your diet whatever coloring agents, preservatives, chemicals that are used, these are all substances, what is called as xenobiotics, which are available, which you consume. So your diet is very, very important. And how to manage your diet? Probably you should have lots and lots of greens and fruits and limit the sugar. That is the best way. So deviating, going away from the diet, our body system has an immune system. How does the body take care of cancer cells? Now you all know, immunity, that's become a very favorite terminology after the COVID. This immune system has a mechanism, our body itself has a mechanism which identifies the cancer cells and then takes it to one place and destroys the cancer cells. So that means we need to lead a healthy lifestyle and we need to have good immune system. Earlier speaker mentioned, lifestyle is changed. How does it cause cancer? Now, immune system is very, very active if your lifestyle is healthy.
Doctor says that she's health conscious and she loves vegetarian, but she includes a lot of mushrooms and paneer in her diet. So I'd like to know if that's healthy, really healthy.
Anything in moderation is good. And if you're looking into mushroom, there are no reports as of now that mushroom is linked to cancer. Only thing what has to be very careful about mushroom is Suppose if the mushroom is infected with aspergillus or mucor and it develops that black spots or the green spots, that you have to be careful, because these what we call it as aspergillus and mucor, rhizopus mucor, these are known to be carcinogenic. So that is one thing. But mushroom is a healthy food. Paneer is also a healthy food.
ಸರ್, ಇಲ್ಲಿ ನಮ್ಮಲ್ಲಿ ಆಹಾರ ಪದಾರ್ಥಗಳನ್ನು ಹೆಚ್ಚಾಗಿ ಪ್ಲಾಸ್ಟಿಕ್ ಅಲ್ಲಿ ಕೊಡ್ತಾರೆ. ಈವನ್ ಹಾಟ್ ಮೀಲ್ಸ್ ಆಗಿರ್ಬೋದು ಅಥವಾ ಏನೋ ಡಿಶಸ್ ಆಗಿರ್ಬೋದು, ಪ್ಲಾಸ್ಟಿಕಲ್ಲಿ ಹಾಕಿ ಪಾರ್ಸೆಲ್ ಇದರಲ್ಲಿ ಕೊಡ್ತಾರೆ. ಇದರಿಂದ ನಮ್ಮ ಇಮ್ಯೂನ್ ಸಿಸ್ಟಮ್ಗೆ ಎಫೆಕ್ಟ್ ಆಗೋದಿಲ್ಲ. ಪ್ಲಾಸ್ಟಿಕಲ್ಲಿ ಫುಡ್ ಐಟಮ್ಸ್ಗಳನ್ನು ತುಂಬಿಸಿಕೊಂಡು ಪಾರ್ಸೆಲ್ ಮಾಡಿ ಪ್ಯಾಕ್ ಮಾಡಿ ಕೊಂಡು ಹೋಗುವಂಥ.
ಕಾರಣ ಅಂತ ಹೇಳಿದರೆ ಐ ವಾಸ್ ಖಾಲಿ ಡಯಟ್ ಮೇಲೆ ಮಾತ್ರ ಫೋಕಸ್ ಮಾಡಿದ್ದು. Technically, you are not supposed to have any hot food in that, get it in that hot box or anything. Because when you put anything hot, the chemicals, the plastic chemicals leaches out. And especially this black box in which you get this home delivery things. What happens is you keep it for a long time. And the plastic, that black color plastic leaches out more. So you're technically not supposed to have it, because there is a chemical compound what is known as biophenols which get leached out of these plastics.
Thank you, doctors, for the very useful information provided to us. Please could you enlighten us as to how to take this vaccination, HPV vaccination, the procedure?
Vaccination you can ask in any of the hospital or any doctors. It's available in the market. It's been there for last more than 15 years. And I've been trying to tell the parents, but looking at the cost, nobody wants to come back. But the benefit is so much. My 2 daughters, I gave it. So it's better, and that's an added responsibility of every woman to make sure that her daughter gets a HPV vaccine. Cost is it comes to about 7,000 to 8,000. That's it. But it's worth health investment.
There is one question from student side. During menstrual period, how to get rid of stomach cramp and vomiting?
If you are having a recurrent cramps, vomiting, all these things, it's better to do a USG and see for any cyst, okay, PCOD or any cyst, any pathology in the abdomen. So without any pathology also, you may have this cramps and all. If it is too much, then we give a tablet to reduce that, okay, that we give as a meftal okay, mefenopic acid we give to reduce that. But if you have a recurrent cramps, vomiting, all these things, one USG abdomen is advised to rule out any pathology.
Excellent presentation, doctors. Wonderful. I attended several discourses of Dr. B.M. Hegde to the people in the audience. If you have sound 2 hours sleep, that is enough to become more passion and energy to recoup and do the work. Is it necessary 7 to 8 hours sleep? Is it 7 to 8 hours sleep is necessary? According to Dr. B.M. Hegde, he says that only 2 hours is sufficient to energize. 2 hours sleep is sufficient to energize next day activities.
Dr. B.M. Hegde has given lectures for promoting himself, so we don't heed to any of his advices. We don't agree with whatever he says. All his lectures are anti-establishment, is to promote, to get popularized. When you speak anti-establishment, you become very popular. I was a student. I'm ashamed to tell that I was a student. I think that should explain.
Valuable contribution. I hope all our students got the good information. Now, one more contribution. Sir, I read an article in that vegetarian is very good. In case of non-vegetarian, 2-legged and less than, and 2-legged more than. That means 2-legged, that is, we say, fish. Fish does not have any legs, except prawn. But we have chicken, it has 2 legs. If you go for other, that is mutton, beef, everything, that is having 4 legs. Now, they used to say that less than 2 legs non-veg is good rather than 4 legs? Please suggest, sir.
I'll scientifically put it in this way. If you take poultry, it's a very simple thing. You don't have to worry much at all. You take mutton, pork or beef and you see the color. There's a lot of red meat in it because the hemoglobin content, all these things are there, plus the myosins also are this one.
From the student side, ಕ್ಯಾನ್ಸರ್ ಎಂದರೆ ಬರೀ ಹೆಂಗಸರಿಗೆ ಮಾತ್ರವೇ, ಗಂಡಸರಿಗೆ ಬರುವುದಿಲ್ಲವೇ? ಇಫ್ ಬರುತ್ತದೆ ಅಂತಾದರೆ ಡು ದೇ ಹ್ಯಾವ್ ಎನಿ ಪ್ರಿಕಾಷನ್ ವ್ಯಾಕ್ಸಿನ್ ಲೈಕ್ HPV? ಇದು ಒಂದು ಕ್ವೆಶನ್. ಆ್ಯಂಡ್ ದೆನ್ ಸಮ್ಟೈಮ್ itching on breast and red dots. Should one be worried and visit doctor?
Yeah, definitely you should be worried about the itching and this, as I told, along with the lump, discharge, any skin changes and itching, pain, all this is because you have to immediately consult a doctor. Okay, the fungal infection also may lead into itching, but whatever symptoms you are having, you need to consult a gynecologist as early as possible.
May I now request Mr. Dharmaraj Amunje to hand over a memento to the doctors as a token of love for enlightening our thoughts.
For presiding over this function and for wishing the program a success. I thank him in his absence. My profuse thanks to Mr. Dharmaraj Amunje, his family and the team for conjuring this idea and spreading awareness on the so-called deadly disease cancer. Thank you for choosing Besant Women's College as the starting point of the inauguration of the various activities you have planned to organize in the coming days.